Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Dehydration in elderly adults. Introduction. Dehydration happens when a person's body does not have enough fluids or electrolytes to work right. It is a common problem for elderly adults. In healthy individuals, mild dehydration can be treated at home by drinking more fluids and getting enough electrolytes. Severe cases of dehydration require treatment in an emergency room. This program explains dehydration in elderly adults. It discusses the symptoms and causes, as well as how to treat and prevent dehydration in the elderly. Dehydration. An average person needs about 8 8-ounce glasses of water on an average day. People lose water every day in the form of water vapor breathed out. People also lose water through sweat, urine, and stool. Dehydration happens when a person's body does not have enough fluids to work right. People can become dehydrated if they lose more fluids than they take in. A person can also become dehydrated if their body doesn't have the right balance of fluids and electrolytes. Electrolytes are very important in neurotransmission, or the ability of the nerves to talk to each other and control the muscles. They also help with water movement in the body and its cells. Sodium and potassium are examples of electrolytes. Dehydration can lead to serious complications, including coma and death, heat illnesses, hypovolemic shock, kidney failure, seizures, swelling of the brain. When not treated promptly and appropriately, severe dehydration can be fatal. Symptoms. Symptoms of dehydration in adults include dry mouth, skin, and mucous membranes, decreased urine output, lack of sweating, headache, dizziness or lightheadedness. Normally, when a person pinches a bit of skin on the arm and then lets it go, the skin will fall right back down into place. If someone's skin does not snap back to its normal position right away, the person may be dehydrated. Urine color can indicate dehydration. Clear or light-colored urine means that the patient is well hydrated. Dark yellow or amber-colored urine could mean that they are dehydrated. Certain medications can affect the color of a person's urine. If someone's urine changes color, they should talk with a healthcare provider. Thirst is a common symptom of dehydration among adults and children, but elderly adults may not become thirsty when they are dehydrated. As people age, their sense of thirst is reduced. Other symptoms of dehydration in the elderly can include confusion, constipation, increased falls, fever. Contact a healthcare provider right away if a patient is severely dehydrated. The person is or may become severely dehydrated if they cannot keep fluids down, has diarrhea with or without vomiting or fever, is irritable, disoriented, or sleepy, loses consciousness.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Common causes of dehydration include diarrhea or vomiting, excessive sweating, fever, increased urination. Severe acute diarrhea is diarrhea that comes on suddenly and strongly. It can cause a severe loss of water and electrolytes in even a short amount of time. If a person has vomiting along with diarrhea, they will lose even more fluids and minerals. Water and minerals can also leave the body through sweat. Physical activity can lead to dehydration if the person doesn't replace the fluids they lost from sweating. Hot, humid weather can make a person sweat more. Fever can also cause dehydration. The higher the fever, the more dehydrated the person may become. Fever combined with diarrhea and vomiting removes even more fluid from a person's body. Increased urination is most often the result of undiagnosed or uncontrolled diabetes. Diabetes is a disease that affects the way the body uses blood sugar. Diabetes often causes increased thirst and more frequent urination. Dehydration can also be caused by alcohol, certain medicines such as diuretics, antihistamines, blood pressure medicines, and some psychiatric drugs. Compared to younger people, older adults are more at risk for dehydration. This is because as people age, they can't hold as much water in their bodies, don't feel the sensation of thirst as much as younger adults, may drink less fluid to prevent problems with urinary incontinence. The elderly are more likely to become dehydrated if they live in a long-term care facility, need assistance with feedings, have problems with thinking or making decisions. Other risk factors for dehydration include living at a high altitude, dealing with chronic illnesses, working or exercising outside in hot, humid weather. Diagnosis. A healthcare provider can often diagnose dehydration on the basis of physical signs and symptoms. He or she can identify whether a person is severely dehydrated. When a person is dehydrated, they are likely to have a faster than normal heart rate, low blood pressure, especially when moving from a lying to a standing position, reduced blood flow to the limbs. To help confirm the diagnosis and pinpoint the degree of dehydration, other tests may be used. These tests can include blood tests to check electrolyte levels and kidney function, urine tests. Treatment. In healthy individuals, mild dehydration can be treated at home by drinking more fluids and getting enough electrolytes. It is best to drink water or a sports drink that contains electrolytes. Caffeine can make a person urinate more. This makes dehydration more severe. People who are dehydrated should avoid drinking beverages that contain caffeine, including black tea, coffee, energy drinks, soft drinks. Alcohol can also make dehydration worse and should be avoided. For exercise-related dehydration, cool water is the best option. Sports drinks containing electrolytes and a carbohydrate solution also may be helpful. Severe cases of dehydration require treatment in an emergency room. There, patients can receive electrolytes and fluids through a vein or intravenously. Intravenous hydration provides the body with water and essential nutrients much more quickly than oral solutions do. Prevention. Drinking plenty of fluids can help prevent dehydration. Eating foods high in water, such as fruits and vegetables, can also help. Caregivers can help prevent dehydration by having hot or cold preferred beverages available throughout the day, offering a full glass of water with medications, making drinks more enjoyable by adding orange or lemon slices. In some situations, a person may need more fluids than they usually do. These times include before, during, and after exercising, when the person is ill, when the person is outside and the weather is hot or humid.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Dehydration happens when a person's body does not have enough fluids to work right. People can become dehydrated if they lose more fluids than they take in. A person can also become dehydrated if their body doesn't have enough electrolytes. Sodium and potassium are examples of electrolytes. Symptoms of dehydration in adults include dry mouth, skin and mucous membranes, decreased urine output, lack of sweating, headache, dizziness or lightheadedness. Symptoms of dehydration in the elderly can also include confusion, constipation, increased falls, Fever. Older adults are more at risk for dehydration. This is because as people age, they can't hold as much water in their bodies, don't feel the sensation of thirst as much as younger adults, may drink less fluid to prevent problems with urinary incontinence. In healthy individuals, mild dehydration can be treated at home by drinking more fluids and getting more electrolytes. Severe cases of dehydration require treatment in an emergency room. Drinking plenty of fluids can help prevent dehydration. Eating foods high in water, such as fruits and vegetables, can also help. Caregivers can help prevent dehydration by having hot or cold preferred beverages available throughout the day, offering a full glass of water with medications, making drinks more enjoyable by adding orange or lemon slices.
Thank you for using Explain.